will be discussing length discrepancy. I know, I hope you all know leg length discrepancy. You know or not?
Yes, sir. Unequal limb lengths.
Yes, very good. Is it visible? Okay. See.
Yes, sir. It's visible.
It's visible. Can you read?
Yes, sir. Yes, sir.
Okay. So when there is shortening, suppose shortening means suppose I'm drawing the line diagrams. Okay, just try to understand. Okay, suppose one limb here and one limb here. Okay, getting? Suppose this is
Yes.
left side. Suppose this is right side. Okay, clear? So when there is leg length discrepancy, that means one leg will be little longer and another leg will be little shorter. Suppose this is, and just example, suppose this is 10 centimeter. This is just an example, okay? And this is 8 centimeter, okay? So there is discrepancy of 2 centimeter or not? Yes or no?
Yes, sir.
So 2 centimeter. Okay, so why you will get discrepancy? Anyone? What is the reason behind it? Every time we will get the discrepancy or due to any problem, all the limbs are same, but still you will find the limping gets. So what is the reason behind it?
Sir, during birth.
During birth, okay. Any other reason?
Some muscles.
Muscles, okay, I may consider. You know, there is two types of leg length discrepancy. One is true LLD. So short form is LLD. Okay, just remember leg length discrepancy. The short form is LLD. Okay, so most of the times I will use LLD. Clear? So one is true, another one is apparent. Clear? So one is true LLD, another one is apparent LLD. So what do you mean by true LLD? We have already discussed, but still I am discussing. I'll start. What is true LLD?
So it's not
Okay.
false.
It's not false. Okay, fine. But how you will get?
So because of the bones.
Very good. When there is shortening of the bone or lengthening of the one side bone, either shortening. Suppose there is limb. Okay, there is limb. So you will find suppose knee joint here and here, ankle joint, foot. You can say anything. Okay, so when there is leg length discrepancy, that is true. That means there is shortening of the bone. Okay, shortening of the bone, either femoral shortening, tibial shortening. Okay, so what do you mean by apparent? Apparent one. Apparent means pseudo shortening. Okay, pseudo means, what do you mean by pseudo? Pseudo means false.
So false.
Okay, so pseudo means false. That means true shortening is there, true shortening is not there. Okay, but you will find, still you will find that is shortening in the leg. Okay, so how can you measure? You can take the, for apparent shortening, you can take the measurement from the umbilicus. Okay, you can take the measurement for the umbilicus. Okay, but for the true shortening, you can take the measurement from the where? ASIS. Okay, getting
Yes, sir.
clear? So from the ASIS, you have to measure the true shortening. From the umbilicus, you have to measure the pseudo shortening or false shortening or apparent shortening. Otherwise, true shortening is called structural shortening. Okay, structural. Oh, you can't see. Huh? Structural. Getting clear?
Yes, sir.
So true shortening, the other name is structural shortening. Okay. Next, so what will happen if shortening will be there? Then what will happen? Yes. will it affect to the any region like spine, hip, knee, foot? Will it affect?
The pelvic hike will be there, sir, in one limb.
Okay, I can consider. Very good. Okay, anything?
So the postures.
What will
So
happen?
postures.
Postures. Very good. Okay, postures. So one is posture. Okay, consider posture. Sahil told that is pelvic hike. Yes or no?
The scoliosis occur.
Very good. Scoliosis will develop. Very good. Scoliosis. Okay. Scoliosis. Okay. Then can you read the green board? Whatever I'm
Yes,
writing.
sir.
Yes, sir.
Yes,
Okay,
sir.
fine. Okay, scoliosis. Then so scoliosis you'll find scoliosis in which region? In which
Sir,
region
in
you'll find scoliosis?
where the limb is normal.
In which region I'm telling? In which region means suppose
So
spine.
thoracic.
So you see, okay, thoracic, lumbar. So these are all the regions. But simply you can say in spine there is problem of the scoliosis. Okay, getting later we will
Yes,
decide
sir.
in scoliosis when we will discuss scoliosis chapter in third year. Okay, no, it's in final year I think. Okay, so when we will discuss about the scoliosis, then we will discuss thoracic scoliosis, lumbar scoliosis. Okay, getting. So we'll discuss about the region
Yes,
only.
sir.
Okay. Now simply scoliosis you will find in the spine. Okay, clear? So it will affect the spine. Okay, ultimately it will affect the spine if you will have shortening. Okay. So before shortening you should know whether in normal human being, okay, which you cannot find any shortening. Okay, you cannot, like you can't say there is shortening, but still they have shortening. Getting what I'm trying to tell?
Yes, sir.
Suppose me,
Yes,
if you
sir.
calculate, shortening will be there. Some shortening will be there. Getting how much shortening? So 0.5 to 0.5 to 2 centimeter is normal. Okay, 0.5 to 2 centimeter is normal. So if you measure in my case also, you may find 0.5 centimeter of shortening. You will compare left side as well as right side. Structural I am telling, not one. Okay, getting clear? So 0.5 to 2 centimeter is normal.
Yes, sir.
Okay, but if that shortening will be more than 2.5 centimeter, then this is called shortening, true shortening. Okay, but normal one you can say 0.5 to 2 centimeter. Okay, so if it is more than 2.5 meter, then this is structural shortening. Okay, clear? Clear everyone? Structural one,
Yes, sir.
everyone?
Yes, sir.
Okay, so now spine also you told there is scoliosis. So what about the hip? What about, I'll show you the slide. What about the hip? So region wise you will discuss. Okay, so spine, okay, over. So what will happen to the pelvis?
Sir, one side pelvis drop will be there, other side pelvis hike will be there.
So simply pelvic obliquity will be there. Yes or no?
Yes, sir.
But you do not know whether it is left side or right side. So it depends upon the patient. Okay, so pelvic obliquity. Okay, getting clear? Pelvic obliquity will be there. Clear? Yes or no?
Yes, sir.
Okay, so next pelvis over, then hip. Will it affect to the hip or not? Hip joint. So in
Yes,
hip
sir.
joint, I'll show you one angle. Okay, that is called center edge angle, CEA. Okay, center edge angle. See, center edge angle. Okay, center edge angle. Clear? I'll show you what will happen. The value, normal value is, you can say in some book it is written 20 to 40 degree. Okay, but normally you can consider this as 35 degree. In some book, different data are there. Okay, center edge angle, how to measure, and all these things I'll show you. Okay, so that is 35 degree. Okay, but when due to shortening it will affect the pelvis, you will find that this value will be decreased. Okay, getting? How to measure center edge angle, I'll tell you. Okay, so don't worry about this. Okay, I'll show you diagram in the PPT. I'll show you the diagram. Okay, so the value will be decreased. Okay, getting center edge angle.
Yes, sir.
Okay, next. So it is written. So in hip joint as well as knee joint, hip joint as well as knee joint, you will find degenerative changes. Okay, degenerative changes also. You know that degenerative changes, you know or not? Yes, another thing I forgot to tell you, in hip joint also you will find what type of joint hip joint is?
Sir,
Quick,
hinge type, modified hinge type.
I am telling hip joint.
The hip joint, sir, sorry. The ball
I'm
and
not
socket.
asking ball and socket joints. Okay, getting everyone? So ball and sockets.
Yes,
So
sir.
I'm just showing, try to understand what I'm. Can you see the diagram?
Yes, sir.
Okay, suppose this is head of femur. Yes or no? Head of femur. Getting? This is
So acetabulum.
acetabulum. Very good. This is acetabulum. Getting everyone? Clear? So
Yes,
it
sir.
is written in shortening. See the covering. So I'll tell you also center edge angle. From this also I'll show you. Okay. So this is your head. Okay. You can see some coverings here. Okay. acetabulum coverings here. So due to shortening, this covering will be also decreased. So like this, you may find like this. Okay. Getting? So it is now it is little unstable. Yes or no? Because the covering will be decreased. Okay. So in which side you can
Yes,
say,
sir.
sir, will it happen in shorter length leg side or longer length leg side? Getting my point? So these things will happen in long limb length side. Long limb length side. Okay? Here? Yes or no?
Yes, sir.
Another thing. Yes, I told you CEA, center edge angle. So center edge angle is otherwise called as angle of Weiborg. Remember, angle of Weiborg. Have you completed your biomechanics, hip joint biomechanics?
Yes, sir.
Have you read angle of Weiborg, center edge angle, all these
Ye-
things?
Yes, sir.
Okay. So this is called CEA, center edge angle is otherwise called angle of Weiborg. So how to measure? Suppose I am just drawing the normal one. Okay. So this is the center point. Can you see the diagram?
Yes, sir.
Yes, sir.
Wait. See. So suppose this is the point. So you have to draw the one perpendicular line here. Getting? So if you consider the head of the femur as a circle, then you can find out the center point or not. Getting? Can you find out the center point? Yes? Afini? Am I
So your
audible?
voice is breaking.
Yes, sir. Your voice is
Okay.
breaking, sir.
Am I audible right now? Check.
Yes, sir. Yes, sir.
Am I feeling clear? Am I audible right now?
Yes, sir. Yes,
Okay,
sir.
fine. See, so this is the center point. Okay, so you can draw the perpendicular line. Yes or no? Can you draw that?
Yes, sir.
Yes, sir.
Okay. Now I told you center is. So how to measure? Can you see the covering? Acetabulum covering here. This is the end point of the acetabulum covering. Yes or no? This point.
Yes, sir.
Mark it. Yes or no? Acetabulum covering in normal I am telling. Yes or no? Can you find out or not? In X-ray, you have to mark everything. In
Yes,
X-ray,
sir.
you will see. Okay. So this is the point. Then from the center, you have to join this point. Okay. So these things will create an angle. This is varies in between 20 to 40 degree. First, normally you can say this is 35 degree. Okay. This is 35 degree. Okay. Clear?
Yes, sir.
Okay. But what will happen if you will have LLD? What will happen? So your acetabulum covering will be decreased. Yes or no?
Yes, sir.
Just see. I'm drawing it again. So as the covering will be decreased, suppose like this, then so it was previously here. Yes or no? Now these things will be decreased. So obviously the angle will be decreased or not?
Yes, sir.
Getting everyone?
Yes, sir.
Am I clear?
Yes,
Yes,
sir.
sir.
Okay. Now these things will happen in the hip joint. Okay. And also another things will happen in hip joint, that is your ground reaction. Okay, regarding the ground reaction force, I'll show you the diagram. Okay, now hip joint and knee joint, you will find that is degenerative changes will be there. Okay, degenerative changes. Okay, so what about the foot? So two category you'll find. So one is pediatric or child category, another one is adults. So in both case you'll find shortening, yes or no? Both case. Okay, but in pediatric group, how they will try to compensate if there is shortening? So how the person will try to compensate or not? Getting?
Yes, sir.
Yes, sir.
Okay, so how the person will try to compensate? So in pediatric group, they will work with toes to compensate the shortening. Clear?
Yes, sir.
But how the adult group will try to compensate? One gate pattern is there. Okay, I'm requesting everyone just try to search vaulting. Vaulting, not now, we'll discuss vaulting. So vaulting is a type of pathological gait pattern. The adult group will try to follow this pattern, and also with that is lateral trunk bending associated with pelvic tilt with lateral trunk bending. Getting? Okay.
Yes, sir.
And also one thing you'll find, we'll discuss also, the person will try to pronate the foot in the long side. Okay, longer side, the side which is longer. On that side you will find, in some cases you will find is the person will try to pronate the foot, okay, in order to match the limb length. Clear? Everything clear?
Yes, sir.
Anything you want
Yes,
to
sir.
ask? So whatever we have discussed, I just gave you some brief idea about what is limb length discrepancy and how it will affect the different body parts, and the reasons also we'll discuss. Okay, with the diagrams I'll show you. Clear everything? Sanju? Sanju, can you hear me, Sanju? Basit? Giri? Why they're not responding? I don't know.
Sir, Giri is having net problem, sir.
Okay,
I
fine.
think.
No issue. Okay, so I'll show you PPT. Do you find any problem with video? Is it buffering or working very smoothly?
So it's fine,
New
sir.
network
Sir,
connection.
it's
It's
okay.
fine.
Yes, sir.
Yes, sir.
Can I stop video or is it fine?
Sir, it's okay.
Sir, it is fine,
It's
sir.
clear? Fine? Okay.
Yes, sir.
Then let the video on. Okay, I am sharing the PPT. Can you see? Can you see the PPT?
Yes, sir.
Afini, can you see it?
Yes, sir.
Wait. Yes, so we'll discuss what is LLD, the types also we have already discussed, that is, tell me the types.
Sir, true and
True,
apparent.
yes, sir.
True and apparent. Okay. Just give me a second. Okay, now see, it's working.
Yes, sir.
Yes, sir.
Fine. Then causes also we'll discuss. Then effects also. I gave you some idea about the effects. Like in spine, you will find scoliosis. Like in also hip joint, how it will affect the hip joint, how it will affect the knee joint, how it will affect the foot also. I gave you some idea. Okay. Now, know everything. So yes, it's moving. Yeah. So definition, you already know that. That is limb-length discrepancy, or that is otherwise called anisomelia. Just remember, anisomelia. The other name of the limb length discrepancy, the other name is anisomelia. Okay. So it is defined as a condition in which
Yes, sir.
at lower extremity limbs have a noticeable unequal length. Can you see the diagram? Can you see it? Can you see the mouse point?
Yes, sir. We can see the diagram, sir.
Okay, I don't know, can you see the mouse point or not, but still if you can see one limb length is longer than the another limb. Okay. Yes. So see the introduction. Limb length equality in the lower extremity is not only cosmetic concern but also a functional concern also. So what is the difference between cosmetic concern and the functional concern? Anyone? Just describe cosmetic and functional.
So cosmetically means appearance.
Very good. Cosmetically means appearance. That means like in the way we are walking, okay, you cannot identify is there any problem or not. If there is any problem, that means the outside person will identify, okay, that person is limping, yes or no. That means at the same time the affected person may feel embarrassed, yes or no. Embarrassing situation will be there. Getting? So cosmetic
Yes,
concern
sir.
is also a part, and also it will affect the functional concern also. Functional concern means like you will find scoliosis, you will find that is hip joint problems, knee joint problems, in ankle also you will find problem. So there is functional concern also. Okay, getting?
Yes, sir.
then
Yes,
limb
sir.
length inequalities of 0.5 to 2 centimeter are common in the normal asymptomatic population. I already told you 0.5 to 2 centimeter is common. Okay, in me also you may find 0.5, maybe 1 centimeter. I can't say. Okay, maybe 0. Okay, but 0.5 to 2 centimeter is common. Okay, clear?
Yes, sir.
And if it is
Yes,
more
sir.
than 2.5 centimeter, it is considered as significant LLD. Okay, and it may affect like knee joint, hip joint, and spine also. Knee, hip, foot, and spine. In each and every part, it will affect. Okay, so what will happen? The short leg gait is awkward. Why? Because increases energy expenditure because of the excessive vertical rise and fall of the pelvis. Yes or no? So
Yes, sir.
obviously
Yes.
energy expenditure will be more. I'll show you one diagram actually I have. I'll show you at last. Okay, I have added that diagram. I'll show you how the energy expenditure will be more. Okay, do you know? Okay, let me tell you otherwise. Do you know on that curve that is center of gravity? Do you know that curve? Do you know that curve? Like this. Can you see me?
So, pardon?
Can you see me in your phone?
So
Can
it's
you see
breaking,
me?
sir. Videos.
Okay, now is it okay?
Yes, sir.
Can you see me in your phone? Yeah, only you can see the slide.
So we can see you, sir.
You can see me? Okay, fine. So I told you that is, there is center of gravity movement while walking. Can you see the curve? Everyone,
Yes, sir.
Yes, sir.
you know that is, what is the name of this curve? Do you know? It is called sinusoidal curve. Okay, that is, you will find smooth center of gravity movement. Okay, CG movement. Okay, but but in limb length discrepancy, you will find the curve will be like this. Okay, like this. Somewhere it is high, somewhere it is less. Okay, getting clear?
Yes, sir.
Yes, sir.
So these are the problems. So if you find the curve is not symmetrical, then obviously the energy expenditure will be more. Yes or no? Clear?
Yes, sir.
Yes. So then you'll find that is back pain also. You'll find then also compensatory scoliosis. We have already discussed. Okay. Then classification already told you structural classification that is called true. Okay. True LLD. I think I have not written true or structural or anatomical. Okay. So remember all the terminology. So structural, anatomical, and true. Okay. So all are same. So differences in leg length resulting from inequalities in the bony structure. So when there is inequalities in the bony structure, you will find that is, so you cannot say only shortening you will find. That means in other way also you can say this is one leg lengthening. Yes or no? So that's why it is written an actual shortening or lengthening of the skeletal system occurs between the head of the femur and the ankle joint motives. Okay. So two things it is written, that is head of the femur and the ankle joint motives. You know ankle joint biomechanics. I hope you know ankle motives. Yes or no?
Yes, sir.
Yes, sir.
Okay, which may have a congenital or acquired cause. So due to different causes also you may find shortening, that is it may be congenital or hereditary you can say, then acquired also due to suppose in accident also. Okay, after surgery, suppose due to excessive calcium deposition, one that is femoral length will be longer. So obviously shortening you will find. Yes or no? Suppose due to any reason you have to cut one bone, shortening you may find sometimes due to trauma. Okay, so lengthening and shortening, you will find both the cases, it may happen. Yes. So next is functional. So one is structural, another one is functional or apparent. Okay. Structural, functional. Structural is true. Functional is, that is, false or pseudo or apparent. Okay. So factors other than actual bone shortening or lengthening make one leg shorter or longer than the other. A functional inequality occurs. So there is functional inequality occurs also. Okay. So like I can say due to pelvic tilt. Okay. Due to any reason you will find pelvic tilt. So obviously you will find shortening. Okay. Unilateral asymmetry of the lower extremity without any concomitant shortening, without any shear shortening of the osseous components of the lower limb. Osseous components means bony. Okay. If you will not find any bony shortening, then that is called functional or apparent shortening. Clear? Clear?
Yes, sir.
Yes. Lot of things are there.
Yes, sir.
Yes. So as per the classification, it is classified into mild, moderate, and severe category. Okay. So it is reported by McCaw and Bates. Okay. So according to them, mild is less than 3 centimeter. If the shortening is, suppose left side is shorter than right side up to 3 centimeter, then that is called mild LLD. Okay. Then if it is between 3 to 6, then it is moderate. If it is more than 6 centimeter, then it is called severe shortening. Okay, clear? Getting?
Yes, sir.
So just remember the author's
Yes, sir.
name, McCaw and Bates. Yes. So etiology. So what are the causes? Okay. So what are the causes of the, yes. Can you see it is written etiology of undergrowth? Okay. Another causes are there, etiology of overgrowth. Undergrowth means the growth will not happen. So from the hereditary cause due to, suppose one bone will not develop. So you will have shortening or not? Suppose femur will develop. Getting? Or tibia
Yes, sir.
will not develop. Have you seen this type of case? No?
No,
So
sir.
in prosthetics, you have one chapter that is called congenital skeletal limb deficiency. Okay, congenital skeletal limb deficiency. In that chapter, okay, so you will go through all types of amputation. Okay, one is transparent, another one is that is longitudinal, another one is. Have you read congenital skeletal limb deficiency?
No,
So one
sir.
is longitudinal, another one is transverse. Okay. So we'll discuss in prosthetics. Okay. So just leave it. So in some cases you will find one bone will not develop. Okay. That is called undergrowth. Okay. Some bone will develop, but after some time it will cease. Okay. That means growth will not happen. Getting? That means you will find shortening or not. In one leg, the bone will grow. Okay. Whatever the growth will be there, it will grow. But in another limb, the growth will be ceased. Then definitely shortening will be there. Sometimes fibular shortening or fibular deficiency or tibial deficiency also in cases you will find, or fibular deficiency also in some cases you will find. Okay, so it's written congenital limb deficiency, that is femoral deficiency or fibular deficiency also sometimes there. Okay, asymmetrical neurological disorders like hemiplegic CP, poliomyelitis, then hemimyelomeningocele. Okay, so these are the cases. We'll discuss hemiplegic CP, you already know that, but poliomyelitis, and that is myelomeningocele also. These things you will be covered in the orthopedics. Okay, clear?
Yes, sir.
Yes, sir.
Then traumatic causes. So one is malunion. Then second one is growth plate arrest. Malunion, you know malunion. Malunion you know or not? Suppose there is compound fracture. I'm just giving one example. Compound fracture. What is compound fracture?
So fractured into many pieces.
Yes. So obviously you will follow which surgery? Open or closed surgery?
Sir, open,
So
sir.
close.
So within 5 minutes we'll end our class. Okay, fine. So we'll discuss the cause. Okay. So you will go for open surgery. So during surgery also, so if you will not treat, suppose there is fracture, okay, there is fracture and you will not treat the fracture. So definitely, so in compound, so you just leave the compound fracture. In simple fracture also, okay, in simple fracture also, if you will not treat that, then obviously, so it is our body mechanism. So after fracture will happen, then obviously calcium deposition will be there or not. Normal mechanism, normal body healing mechanism. Yes or no?
Yes, sir.
So before that we have to arrange the bone. But if you will not arrange the bone by surgery or by close reduction also, if you will not arrange that bone, then definitely due to calcium deposition also, you may find malunion will be there. So one bone will be overlap with the other sometimes. That is called malunion. Okay, so due to calcium deposition, they will be united. Okay, so obviously the length will be decreased or not if it is
Yes,
malunited.
sir.
Getting everyone?
Yes, sir.
Then
Yes, sir.
growth plate arrests. What do you mean by growth plate? You know, have you read the long bones? Growth
So
plate.
growing end of the bone.
What is that? What is that called? In long bones, the classification you might have read. One is
So
called
epi
epiphysis, diaphysis. Have you read epiphysis, diaphysis? Yes or no?
Yes, sir.
epiphysis.
So epiphysis.
Yes. So epiphysis, that is called growth plate. So when there is arrest or cessation, okay. So when the growth plate will cease, then definitely that bone length will not be increased. So definitely you will find shortening. Yes or, yes or no?
Yes, sir.
So other causes, infection, tumor, that is post irradiation, then Blanche disease, LCPD. LCPD means leg cap Porthes disease. Porthes disease we will discuss. Okay, Porthes disease. We'll discuss, huh? In detail, we'll discuss like a pathology. Blanche disease already told you. What is Blanche disease? Just give me one idea. Blanche disease. Blanche disease. I told you once. Have you remembered? Afini? One deformity you will find in
Yeah,
Blanche
I
disease.
don't remember.
Tibial vera. Have you remembered? Tibial vera. Okay, it is related to tibial vera. Okay. Still, if you do not know, then go through Blanche disease. You may get short notes. I told you it is very important. Okay. Then unilateral club foot also. Club foot, you know that in first year. You have
So
covered club
CTV.
foot. Yes, CTV. So one letter unilateral, that means one side CTV also it may affect. Shortening you may find. Okay.